People often think, oh, FQHCs, oh yeah, those are those free clinics, right? Free clinics for poor people. One of the things I like about this building is that it changes that conception.
And the children looked up and they looked around and they said, is this for us? Now, doesn't that touch your heart? Yeah, this is for you.
And he said, essentially, you're telling me I'd be better off if I went to a community health center than if I went to a private provider. And I said, that's what I'm telling you.
We are growing at rates that are hard to really even understand and comprehend, because this integrated model that we're trying to practice really doesn't just serve the poor, it really serves everyone better.
My parents didn't have the money. So I thought to myself, I want to help those type of people, because I was one of those people.
I also like that they are innovative. They are one of our partners that are the cutting edge of changing how healthcare is delivered, about using data to focus on quality in a person-centered way, and that's what the future of healthcare is about.
One of the main purposes of the Primary Care Association is to forecast in the future and to look and examine how healthcare is evolving and to help our health centers get ahead of the curve. And as part of that, we've adopted this strategy of owning our future.
In 1967, the first community health center to open in Missouri was the Samuel U. Rogers Health Center. From there, the health center movement spread across the state. But as years went by, it became clear that a unified presence, along with leadership and a strong policy voice, was needed. So in 1984, the Missouri Primary Care Association was founded.
The MPCA, again, that's another household word. My mother, I believe, was probably one of the founding members of the MPCA and has worked very hard and recognized very early on, along with the other CEOs throughout the region, how important collaborative work is going to be.
The strength that I saw in those people who were fighting against a lot of odds at the time to bring quality, affordable health care to the people in their communities was quite inspirational.
There wasn't the infrastructure for health centers when you were getting started, so there were no training courses, no guidebooks. You just started contacting people with questions, and of course you got different answers, and so you had to figure it all out on your own, and you made mistakes. I mean, you do.
The Missouri Primary Care Association started in 1984 when a group of healthcare leaders from rural and urban Missouri got together and decided they would collectively be better together than operating in silos in local communities. So folks like Frank Ellis, Jack Klingon, Myrtle Davis, Betty Kerr, and others got together 30 years ago, and here we are sitting here today, 30 years, 2014, still moving forward.
Community health centers have evolved into a thriving health network across our state. Missouri has nearly 30 community health centers, operating in about 150 locations, reaching over 450,000 Missourians, totaling 1.6 million annual visits. Missouri Primary Care Association provides strong support and leadership to our community health centers. They do this by networking community health centers together, providing support toward policy awareness and advocacy, knowledgeable forecasting and insight to current and upcoming trends, and a host of valuable resources and strong partnerships toward visionary initiatives. Some of these initiatives include MOQUIN, a platform to use data to drive quality, the Behavioral Health Collaborative, the Kit Bond Scholarship Program, and the A.T. Still University Dental School Partnership. This partnership focuses on training the next generation of healthcare providers entering the community health environment.
The partnership between the Missouri Primary Care Association and A.T. Still University's Dental School in Kirksville is unique and visionary, and it's based on the philosophy that we have to identify prospective students in local communities who want to serve the underserved. It's kind of a grow your own. It's unique to Missouri. No other state in the country is doing this, and it's something that we're all very proud of. So in the first 2 years of a student's education, they will be in Kirksville, Missouri, and they'll work on site at the university. The third year, the entire class will go to St. Louis and be trained in a 90 operatory clinic run by Grace Hill Health Center. And the fantastic news is that in the fourth year, all of the students are going to go out and be trained in local community health centers throughout the state.
This dental school, the Missouri School of Dentistry and Oral Health, this was the type of dental school that my colleagues and I always wanted to have. And what's really unique about this dental school is that the entire clinical training for these dental students will be done in a manner that the students are delivering care to underserved, underinsured, and otherwise disadvantaged population groups.
A will to not quit is what motivates me. I have a dream, I want to pursue it, and I could be spending this time doing anything, so I figure I might as well do it, pursuing what I love.
And it's so rewarding to hear the stories when you speak to these patients after they've had a tooth extraction, that they've been in pain for months, that they've not been able to seek care because maybe they're in an area where they don't have access to that care.
It's a monumental step in the right direction to help meet the needs of oral health care in the state of Missouri. And Grace Hill Health Centers is just really privileged to be a part of it.
The Behavioral Health Collaborative focuses on integrating behavioral health into the primary care model.
The provision of mental health services has been the missing link for quite a long time, but we're now realizing that mental health has a significant impact on one's quality of life.
The big initiatives you see across healthcare today is serious efforts and demand really to integrate behavioral health with primary care and general medical care.
So our board considers ourselves the custodians of our community's health and decided that if we're going to deal with the health of a community, we cannot omit behavioral health. And this opportunity gave us the opportunity to bring behavioral health under the same umbrella as primary care and deal with it all at once.
And if you think about it, in the end, using healthcare is about behavior, and it's about changing behavior. So it's both about behavioral illnesses, but it's also about behavioral approaches to get those good healthcare outcomes. Pills don't do it alone. It's how people use them.
Is that we know the statistics that if in the exam room we find a child that has obvious behavioral health issues, if we try to send them down the street for help, they might show up 20% of the time. If you send them down the hall in the same building, they're likely to show up some 70% of the time. But if when they're with a pediatrician, you bring a psychiatrist or behavioral health expert into the exam room, you're likely to get closer to 100% compliance. So the two under the same umbrella, it's intuitive almost that it takes away the stigma because it makes a behavioral health visit look like a primary care visit to a parent, and the parent doesn't feel the stigma of my child has a behavioral health issue.
And it's what we call a warm handoff here, and so they get that connection made. It's not, you don't have to go to a separate facility and have the stigma of, oh, I'm getting behavioral health care. So that's a really good thing. That's an excellent thing that happens for us, and people feel good about making that connection.
MOQUIN, the Missouri Quality Improvement Network, brings cutting-edge health information technology, clinical, and quality together.
The Missouri Quality Improvement Network is really organized to bring all of our health center members together in a collective effort to improve quality across the state in the interest of better care for our patients.
And what we're able to do from that now is to get baseline data on some of the important quality indicators of health. Now we can identify what needs quality improvement, What do we want to work on together to make sure that we are advancing the mission of having all of our health centers deliver the gold standard of quality care?
We have an integrated health system here at Jordan Valley to where any patient that's seen in the dental clinic has a dental or a health record that can be viewed by any of our medical providers at the same real-life time.
So it keeps us focused on patient care, best practices, and how to get there, and to help us learn from others that have been there and are having success. We're able to learn from others within the state or across the nation.
I think as patients, that's the kind of care we all want, because we want that to be coordinated care and we want it to be the best care we can get.
In America, healthcare has been a cottage industry. It's been a bunch of isolated individuals thinking what they kind of think the right thing to do is, or what they best can remember the right thing from when they were trained 10 years ago. And it's not had the kind of evidence and standardization and follow-up that even simple things like getting a pizza from Pizza Hut has more standardization than medical care in many primary care practices.
So we've really put a premium and a focus about owning our data so that we can own that data, drive local quality improvement efforts, so that when that data is out there for public consumption, our patients know that they're coming to a quality provider.
The Kit Bond Scholarship Program awards tuition and reimbursement to medical, dental, and nursing students who have a desire to serve in community health.
The shortage of medical and dental professionals presents an enormous challenge to community health centers and the patients we serve. And that is one of the main reasons we created the Kit Bond Scholarship Program, to meet that challenge head on. And that program is geared towards providing loan repayment and loan forgiveness to health professionals that want to serve the underserved, that are going to immediately be inserted into the health workforce to serve the underserved populations.
They chose to acknowledge my work and to help me kind of forward my career with additional funds to kind of allow me to pursue my goals in community health.
It is such a deserving group of individuals that we serve. So this scholarship is going to help us motivate some of the best minds in the community to come to community health centers and serve as physicians, providers, and really get a feel for what it's like to serve this underserved population. And I expect that this scholarship is going to yield great experiences for these individuals who might never have thought about going into community medicine, might spend their careers in community medicine, and I think there's nothing more rewarding.
People are, I say, called into this work to serve, and they want to help people and make their lives better. So servant leadership really fits with that very well.
I bring my son here. My son's pediatrician is in this building because I honestly believe in the quality of the work that we do. So, you know, I really believe that this is for everybody. Rich, poor, it doesn't matter.
You know, the Primary Care Association, its members, are nationally known as leaders in the primary care world and in the broader healthcare industry. And how they have done that is by being good partners. You know, executing well in today's healthcare world means taking care of the other party's needs, not just their needs. And they get that at MPCA, and the members get that.
Missouri Primary Care has been our shining star to look for when we want to move forward.
We're a member of the Missouri Primary Care Association, and it's probably one of the best in the United States.
I would say that they're probably as well respected by other primary care associations throughout the country, and it makes you feel good that you know you've got an advocate.
I don't think as a CEO of a health center in Missouri that we would have been able to survive without the Missouri Primary Care Association.
I'm probably one of the biggest fans of the MPCA because I don't think we could have made it through that first period without their assistance.
I couldn't do what I do at a local level without the Missouri Primary Care Association as a resource. I would say that they are my number one resource. I view them as my number one resource.
15 years ago, we had 14 community health centers providing services in about 70 locations to about 200,000 Missourians. Today, we have 29 community health centers in every region of the state, serving 450,000 Missourians through about 150 locations. So we've seen enormous growth over the past 15 years, and that's due to the vision of our community health center executives and their board members at the local level.
Today's Missouri Community Health Centers are united. Together, we are owning our future.